Hi again, Dr. Pam here. How are you? After working for over 6 years with addiction, I've come to realize that addiction is a 360 event, or it's a 360 business, because the patients, they need support all around 360. You know, I always tell my patients that addiction has to be treated like any other disease, and where you need support from your family, where you need any support that is going to help you from your close friends, family, and where you have to surround yourself with people who are rooting for you, who are supporting you, who are putting your interest first. As any disease, as when somebody is diagnosed with diabetes, with high blood pressure, with HIV, with COVID now, addiction should be treated the same way. One thing is that I know that the patient has to know that they need help. And when they know they need help, they have to look for that help. If they don't look for the help, the family will help them find for the right medication, for the right treatment that will work for them. If it is alcoholism, somebody struggling with alcoholism, we treat them with different, we can treat them with Vivitro. Vivitro is an injection that we give, and they are given once a month. They are not supposed to drink. It helps them to block those receptors that are craving for alcohol. But as you work, as you get the injection, you need to go for the support, Alcohol Anonymous. Go for your support there. You need to have support from home. Your family, your wife, your husband, your children, your significant other, because you need that support. Also, families have to understand that when somebody is going through alcoholism, it is a disease like any other. They need compassion, they need love, they need everything that will help them. One other thing you have to understand is that they can get the Vivitro, they can get help with Vivitro, but also they might fall into getting addicted again, or after 3 years, 2 years, 1 year of not drinking, something might trigger and they might go back to drinking. As a family, you are there to support them as they go through this journey, because that is not the time you'll be like, oh, you stopped drinking for 5-6 years and now you're back to drinking. What is this now? That is the time you hold their hand and say, yes, you're falling forward, but you're gonna pick the pieces and we're gonna go through this journey again. You've done it before and you're gonna do it again. I know sometimes it's very, very frustrating for the families because it is not easy. But just assume you had cancer, you had diabetes, you are doing your food regimen, you are eating well, your A1C came back from 9 or 10 back to 5.7 or even to 6, and you are happy. And then something happens, you fall back, start eating, and then it goes up. What would you need? You need support from your family. You need support when you go working on your food. You will go to your doctor and get help. Just the same way with addiction. When somebody falls, they will still need that support from you as a family, from the doctor, from all the people who are around them. Also, when you are working with addiction, when you have addiction, you need to surround yourself with people who are not addicted. That is, you have to remove yourself from the environment and take yourself to an environment that is conducive, that is going to support you. If you had friends who would drink with you, you need to let them go. If you have husband, wife who was drinking with you, they need to stop it. Both of you have to be in rehab, because you cannot stop and another person is drinking in the house. That is a trigger right there. So that is why I said it is a 360 event. If you are addicted to cocaine, if you're addicted to heroin, if you're addicted to any other substance, you need the same kind of support. If you're going to your doctor and you're getting methadone, where you have to be checked every day, or you're given methadone for once a month, or you're given Suboxone films, or you're given Subutex tablet, all those, yes, you will get it, but you also need support from the family, support from the people around you. Even at your place, you might be forced to change jobs. If at your job, that is where you find the cigarettes, if you are addicted to cigarettes, if that's where you find the drugs, you're going to change. That is why I said it's at 360. You have to change. But more so, you also have to meditate. You also have to go to rehab. But also have to remember, God helps. I am a believer. I am going to say what I tell my patients or what I've seen that has worked for other people. Ask God to help you, because it is a disease like any other. You want to get rid of it. You want to, all the support you can, even if you don't believe in God, whoever you believe in, go ask them. Meditate over it. Every time you're going to sleep at night, listen to nice meditation that is going to clear your mind. Clear your mind. Think about, I'm winning. Even when you're taking your medication, I'm winning. That is why it is a 360 event. It is just not a one thing. I'm getting my Vivitrol for my alcoholism. I'm going to be okay. I'm getting my Suboxone for my illicit drugs. I am going to get well. No, it is a 360 event. You have to, when you know you have an addiction, I see my young patients, I support them, I encourage them, and I see what they do when they come. Somebody has stayed a whole month without drinking, a whole month without illicit drugs. I'm like, whoa, I'm excited for them, because I know it gives them that self-esteem, it supports them. So as family members, we also have to, I know sometimes you are overworked. These people have been drinking. They have taken off the money, especially if it's a wife, a husband. They have taken everything. But still, the Bible says, forgive somebody 7 times 70. So you're going to forgive them. They're your family. I know it is hard and they're trying. You're going to support them. They need you because they're your family. If you need a break, take a break and then go back. So for cocaine and heroin and cocaine, Suboxone, methadone, ask your doctor what works best for you, because each person who has any form of addiction is treated differently, because the kind of treatment you might need is not the same kind of treatment B might need. So talk to your doctor. What can work for you? And how can your family support you? What if it's alcoholism? Are you going for AA meeting? If it is addiction, are you going for the addiction meetings? Those all compound together and help you. So there is always hope. I believe that all of us need a second, third, and fourth chance. If we are having any challenges in life, we need second, third, and fourth chance to start all over again. If you fall forward. If you went back, dust yourself, say, okay, I missed. I am going to pick my pieces. I'm going to work again. I'm going to move forward again. That is how you're going to beat the addiction. It is accepting you have a problem, looking for a solution, working with your doctor, working with your family, surrounding yourself with people who support you, who value you, who want the best for you, leaving alone toxic friends who are addicted to whatever form of addiction they have, and joining a group that is going to work to support you. That is how you're going to be a winner. And I know, and I promise you, you will be a winner. Look at yourself and know that you are going to win this addiction. You will win. Just fight. Fight for your life, because you are worth it, because you deserve it. Whatever is triggering you, the trigger, know what it is and fight. Be blessed. Thank you, Dr. Pam. Subscribe and share my YouTube channel. I'm your sister, I'm your mom, I'm your aunt, for here to support you, because I know you need it. Thank you and be blessed.